When you think about a contract, you usually picture like a transactional exchange of services.
Right.
But the promise we make to military service members is supposed to be different. It's a covenant.
Yeah, exactly. You write a blank check to the country, and the country promises to take care of you when you get back.
Right. So our mission today for this deep dive is unpacking the 2026 institutional and clinical crises that are, well, currently destabilizing that covenant.
And it is a very complex situation.
It really is. And to be totally clear right up front, we are looking strictly at the data and the facts surrounding the Department of Government Efficiency's newly proposed workforce cuts. We are leaving partisan politics completely at the door.
Right. No endorsements of left-wing or right-wing views here.
Exactly. We are strictly and impartially reporting what these documents actually mean for the reality on the ground.
Okay, let's unpack this because the sheer scale of the proposed contraction is honestly staggering.
It really is.
We are looking at an 80,000 person workforce reduction at the VA under Secretary Doug Collins. Yeah, and the technocratic logic driving DOGE's mandate is, well, it's strictly mathematical. Following the massive budget expansions we've seen in recent years, their goal right now is rapid fiscal right-sizing.
So they're just cutting costs wherever they can.
Pretty much. They are systematically targeting what they define as non-essential expenditures. So that means canceling about $900 million in non-mission critical contracts
Wow.
and winding down various administrative and diversity programs just to forcibly lower the agency's operating baseline.
I mean, honestly, it's like selling off the lifeboats while the ship is actively taking on passengers.
Yeah.
You are stripping the structural support at the exact moment maximum capacity is required.
Because of the PACT Act, right?
Right. The 2022 PACT Act universally expanded coverage for toxic exposures, so the VA is currently managing this massive 30% surge in new patient enrollment. Demand is skyrocketing, but the workforce is just shrinking.
And if we connect this to the bigger picture, the mechanism of this contraction actually creates a really painful feedback loop. Well, veterans actually make up about 30% of the entire federal workforce.
Oh, wait, really?
Yeah. So a sweeping efficiency mandate at the VA disproportionately eliminates the jobs of veterans themselves.
Oh, wow.
Right. So it's stripping away the exact personnel needed to process the disability claims those same veterans are trying to file under the PACT Act expansion.
That is wild. I mean, that administrative backlog is a massive bottleneck on its own, but leaked VA emails show this freeze isn't just contained to the paperwork.
No, it's not.
It has breached the clinical floor. And here's where it gets, like, really alarming. We are seeing a frozen recruitment pipeline for specialized providers.
Specifically oncologists and mental health staff.
Exactly, which has
Right.
triggered the abrupt cancellation of critical cancer clinical trials.
And this raises a really important point about how administrative austerity cascades directly into patient care. You know, clinical trials, especially in oncology, require an immense administrative apparatus.
Right, you need a whole team.
Yeah, you need data managers, research coordinators, specialized nursing staff. When you just freeze hiring across the board to hit an 80,000 person reduction target, those highly specialized support roles just remain vacant.
So they can't run the trials.
Exactly. Without the regulatory and safety infrastructure in place, the hospital is legally and medically forced to pause the trials, regardless of how badly the oncologists actually want to proceed.
Okay, but let me ask you this. A standard federal hiring freeze usually targets, like, back office bloat. If the VA's research arm is effectively paralyzed, why can't these veterans just go to civilian hospitals for their cancer treatments?
It's a logical question, but we're dealing with the highly specific pathology of combat exposures.
Like burn pits and Agent Orange.
Exactly. The civilian infrastructure simply doesn't have the volume or the specialized baseline to take over those cohorts. These veterans rely on very rare, heavily tailored oncology trials that are designed around unique toxic profiles.
Ah, I see. So there isn't really an alternative.
Right. When the VA pauses these programs, the civilian sector cannot just absorb them on a dime. The patients are basically left entirely stranded. There is no civilian backup plan.
So what does this all mean? We are essentially watching a profound tension play out in real time between fiscal stewardship and the dangerous erosion of the veteran covenant.
Yeah, what's fascinating and really tragic here is that it perfectly illustrates the real-world mechanics of rapid technocratic contraction.
The human cost of it.
Exactly. When you introduce sudden, massive austerity measures from the top down to just right-size a budget, the shockwaves don't just hit balance sheets. Society's most vulnerable populations, the ones who rely on highly specialized, enclosed healthcare ecosystems, they absorb the immediate physical impact.
The covenant was supposed to be a permanent structural guarantee, but if the government just freezes early intervention for high-risk veterans and pauses rare cancer trials,
Yeah, you really have to wonder.
right, who in our local communities ultimately absorbs the moral and medical fallout of that untreated trauma?